Let's go ahead and start. Hello and welcome to the GrannyHandicap live stream. I'm Dennis Cole, your hostess for the evening. And I thought we've talked about a lot of aspects of disability. Let's look at how, let's see, I can't really do how disability is portrayed in movies, but, and, eh, I'm afraid of copyright violations, so I don't want to do that. Hello, Haas. Thank you for the follow. So, what other aspects of disability can we talk about? I had a good topic, and then I went on Forza Horizon 4 and played for a while, and it went. That's what I get for not writing it down. But okay, so we need a topic. Anybody have a suggestion for a disability topic for the evening? And let's see who's here. Really, let's talk about all types of dementia. Let's just make it dementia and disability. All right, so we will look up dementia and learn a little bit about it, because pretty much anyone who lives to be old enough might be at risk for dementia. So I'm going to share my screen and we're going to look up dementia. Let's define it first. And we'll go down to, let's go to the good old CDC and find out what it is and if it is a normal part of aging or not. I tend to think that it is, but I might be wrong. So, what is dementia? And if you've got a loved one who is older in your life, then you may have already dealt with dementia or you may be afraid of dementia. So let's demystify it a little bit. It's nice to know a little about things, to know what to look for and etc. So it's not a specific disease. It's a general term for the impaired ability to remember, think, or make decisions that interferes with doing everyday activities. Alzheimer's is the most common type of dementia. It mostly affects older adults. It is not a part of older aging, so I was wrong about that. How common is dementia? Of those at least 65 years of age, there's an estimated 5 million adults with dementia in 2014 and projected to be nearly 14 million by 2060. So as the population grows, it grows. Many older adults live their entire lives without developing dementia. Normal aging may include weakening muscles and bones, stiffening of arteries and vessels, and some age-related memory changes that may show as occasionally misplacing car keys, struggling to find a word but remembering it later, forgetting the name of an acquaintance, forgetting the most recent events. Normally, knowledge and experiences built over years, old memories and language would stay intact. So, because dementia is a general term, its symptoms can vary widely from person to person. People with dementia have problems with memory, attention, communication, reasoning, judgment, and problem solving, visual perception beyond typical age-related changes in vision. Signs that may point to dementia include getting lost in a familiar neighborhood, using unusual words to refer to familiar objects, forgetting the name of a close family member or friend, forgetting old memories, not being able to complete tasks independently. What increases the risk for dementia? Age, usually over 65. Family history, those who have parents or siblings with dementia are more likely to develop it themselves. Race and ethnicity. Eth- ethnicity. Uh, Older African Americans are twice more likely to have dementia than whites. Hispanics are 1.5 times more likely to have dementia than whites. Wow. Poor heart health, high blood pressure, high cholesterol, and smoking increases the risk of dementia if not treated properly. And traumatic brain injury. Head injuries can increase the risk of dementia, especially if they are severe or occur repeatedly. How is dementia diagnosed? A healthcare provider can perform tests on attention, memory, problem solving, and other cognitive abilities to see if there is cause for concern. A physical exam, blood tests, and brain scans like a CT or MRI can help determine an underlying cause. What are the most common types of dementia? Alzheimer's disease accounts for 60 to 80% of cases. It's caused by specific changes in the brain. The trademark symptom is trouble remembering recent events, such as a conversation that occurred minutes or hours ago, while difficulty remembering more distant memories occurs later in the disease. Other concerns like difficulty with walking or talking or personality changes also come later. Family history is the most important risk factor. Having a first-degree relative with Alzheimer's disease increases the risk of developing it by 10 to 30%. Vascular dementia. About 10% of dementia cases are linked to strokes or other issues, excuse me, with blood flow to the brain. Diabetes, high blood pressure, and high cholesterol are also risk factors. Symptoms vary depending on the area and size of the brain impacted. The disease progresses in a stepwise fashion, meaning symptoms will suddenly get worse as the individual gets more strokes or mini strokes. Lewy body dementia. In addition to more typical symptoms like memory loss, people with Lewy body dementia may have movement or balance problems like stiffness or trembling. Many people also experience changes in alertness, including daytime sleepiness, confusion, or staring spells. They may also have trouble sleeping at night or may experience visual hallucinations. That's seeing people, objects, or shapes that are not actually there. Frontotemporal dementia. This type of dementia often leads to changes in personality and behavior because of the front of the brain it affects, the frontal lobe. People with this condition may embarrass themselves or behave inappropriately. For instance, a previous cautious person may make offensive comments and neglect responsibilities at home or work. There may also be problems with language skills like speaking or understanding. There's mixed dementia. Sometimes more than one type of dementia is present in the brain at the same time, especially in people aged 80 or older. For example, a person may have Alzheimer's and vascular dementia. It's not always obvious that a person has mixed dementia, since the symptoms of one type of dementia may be most prominent or may overlap with symptoms of another type. Disease progression may be faster than with one kind of dementia. And reversible causes. People who have dementia may have a reversible underlying cause, such as side effect of medication, increased pressure in the brain, vitamin deficiency, and thyroid hormone imbalance. Medical providers should screen for reversible causes in patients who are concerning for dementia. And how is it treated? The treatment's going to depend on the underlying cause. Neurodegenerative dementias like Alzheimer's disease have no cure, though there are medications that can help to protect the brain or manage symptoms such as anxiety or behavior changes. Research to develop more treatment options is ongoing. Leading a healthy lifestyle, including regular exercise, healthy eating, and maintaining social contacts, decreases your chances of developing chronic diseases and may reduce the number of people with dementia. If you're If you are worried that a loved one might have dementia, discuss it with the loved one. Talk about seeing a medical provider about the observed changes soon. Talk about the issue of driving and always carrying an ID. Medical assessment. Be with a provider that you're comfortable with. Ask about the Medicare annual wellness exam. That's a neat thing. I do that every year. So, Medicare will pay for a full physical every year if you have it. So that way you can take that wellness exam every year, and then you get a variety of tests that might catch something early while you can still do something about it. It's a wonderful program. And you can do a family meeting. Start planning and gather documents like the Healthcare Directive, Durable Power of Attorney for Healthcare, and an estate plan. So that's also about a living wills, where you talk about things like what you want done if you have a brain injury and you are brain dead. So, do they keep a feeding tube in you, or do they withdraw life support? You know, you want your wishes to be known in a living will. And all states have a form that you can download. And you can just do this yourself. You just go through the questions and answer them. And then you file a copy with your doctor, with your hospital you use, and that way, and make sure your family members have a copy so that they know what your wishes are if something happens where you're not able to speak for yourself. So, definitely it is a good idea to talk about these things with your loved ones. And there are more. So, there's what we have about dementia. So, let's go back and see what else we can find. Let's compare the Mayo Clinic. And I'll put this link there too. And I'll put it here. Alrighty. So Having memory loss alone doesn't mean you have dementia, although it's often one of the early signs of the condition. So, oh, they even have a book on Alzheimer's disease. So if you have a relative that's been diagnosed, it's a good idea to take a look at that and just see what, you know, and we already went over these. So when to see a doctor? See a doctor if you or a loved one has memory problems or other dementia symptoms. Some treatable medical conditions can cause dementia symptoms, so it's important to determine the cause in case it's a reversible thing. And here's more about the different types. And there are other disorders that are linked to dementia. Huntington's disease, which is caused by a genetic mutation. This disease causes certain nerve cells in your brain and spinal cord to waste away. Signs and symptoms, including a severe decline in your thinking skills, usually appear around age 30 or 40. Traumatic brain injury. This condition is most often caused by repetitive head trauma. Boxers, football players, or soldiers might develop it. And it can cause dementia signs and symptoms such as depression, explosiveness, memory loss, and impaired speech. May also cause Parkinsonism, and symptoms might not appear until years after the trauma. This is why it's really important for you to think before you decide that your child's going to play football, because that's one of the risks of contact sports. Creutzfeldt-Jakob disease. This rare brain disorder usually occurs in people without known risk factors. It might be due to deposits of infectious proteins called prions. Signs and symptoms of this usually appear after age 60. It can be inherited. It can also be caused by exposure to diseased brain or nervous system tissue, such as from a cornea transplant. Parkinson's disease. Many people with Parkinson's eventually develop dementia symptoms. Dementia-like conditions that can be reversed. Infections and immune disorders. Dementia-like symptoms can result from fever or other side effects of your body's attempt to fight off an infection. Multiple sclerosis and other conditions caused by the body's immune system attacking nerve cells can also cause dementia. Metabolic problems and endocrine abnormalities. People with thyroid problems, low blood sugar, too little or too much sodium or calcium, or problems absorbing vitamin B12 can develop dementia-like symptoms or other personality changes. Excuse me. Let me get something to drink here. If I can find my water bottle. There it is. It was down there. Ah, that's better. Okay. So, nutritional deficiencies. Not drinking enough liquids, which leads to dehydration. And keep in mind, if your person is not very physically active, they need more water than they normally would. So it's easy for us older folk to get dehydrated. not getting enough B1, which is common in people with chronic alcoholism, and not getting enough vitamins B6 and B12 in your diet can cause dementia-like symptoms. Copper and vitamin E deficiencies can also cause dementia symptoms. Medication side effects. A reaction to a medication or an interaction of several medications can cause dementia-like symptoms. And keep in mind that a pharmacist can only predict the interactions of 3 medications. So if you are on more than 3 regular medications, then there can be side effects that nobody expects because everybody's body chemistry is different. It just means that if you take more than 3, like I do, you need to be aware that if there's a problem and a person starts getting, symptoms that are not usual, then it's good to take a trip to the doctor and let him or her figure out what's going on, because we're not really qualified to figure that out. But that is something to consider if a person is having signs of dementia, that it might just be a medication side effect, and it might be as simple as taking them off one of the medications and substituting another. Subdural hematomas. Bleeding between the surface of the brain and the covering over the brain, which is common in the elderly after a fall, can cause symptoms similar to those of dementia. So it's good if your senior has a fall, then if they start acting differently, you should definitely take them to the emergency room, or at least call your doctor and see what they say about it, because elderly people are more fragile than younger people. So take it seriously if you see changes in their behavior after a fall. Brain tumors. Rarely, dementia can result from damage caused by a brain tumor, and that can happen in anybody of any age. Normal pressure hydrocephalus. This condition, which is caused by enlarged ventricles in the brain, can result in walking problems, urinary difficulty, and memory loss. And many factors can eventually contribute to dementia. Some factors, such as age, can't be changed. Others can be addressed to reduce your risk. So risk factors that can't be changed are age, family history, or Down syndrome. Risk factors you can change are your diet and exercise. Lack of exercise increases the risk of dementia, and while no specific diet is known to reduce dementia risk, research indicates a greater incidence of dementia in people who eat an unhealthy diet, compared with those who follow a Mediterranean-style diet rich in produce, whole grains, nuts, and seeds. So just making your diet healthier and exercising just a little more might prevent you from getting, or might reduce your risk of dementia. Excessive alcohol use. Reducing your alcohol use can help. Several large studies and reviews found that alcohol use disorders were linked to an increased risk of dementia, particularly early onset dementia. Cardiovascular risk factors. These include high blood pressure, high cholesterol, buildup of fats in your artery walls, and obesity. Depression. Although not yet well understood, late life depression might indicate the development of dementia. Diabetes. Having diabetes may increase your risk of dementia, especially if it's poorly controlled. Smoking. Smoking might increase your risk of developing dementia and blood vessel disease. So it's never too early to quit smoking to increase your health. Air pollution. Studies in animals have indicated that air pollution particulates can speed degeneration of the nervous system, and human studies have found that air pollution exposure, particularly from traffic exhaust and burning wood, is associated with greater dementia risk. Head trauma. People who've had a severe head trauma have a greater risk of Alzheimer's disease. Several large studies found that in people at 50 years or older who had a traumatic brain injury, the risk of dementia and Alzheimer's disease increased. The risk increases with people with more severe and multiple TBIs. Some studies indicate that the risk may be greatest within the first 6 months to 2 years after the TBI. So preventing falls for older people is a big concern, and it can be as simple as going around your house and looking for risks. So we probably should talk about that too tonight. Sleep disturbances. People who have sleep apnea and other sleep disturbances might be at higher risk of developing dementia. Vitamin and nutritional deficiencies. Low levels of vitamin D, which comes from not getting outside as much as you need to. Vitamin B6, vitamin B12, and folate can increase your risk of dementia if you have low levels of those. So definitely taking extra vitamin D if you don't get out much is good. Not too much vitamin D because it is a fat-soluble vitamin. If you take too much, you can actually cause yourself to get rickets, which is a bone disorder where your bones curve and are easier to break. So the best way to get more vitamin D is to simply sit outside for 15 minutes a day. So, you know, that and just making sure that you're getting enough vitamin D in your foods. Medications that can worsen memory. To try to avoid over-the-counter sleep aids that contain diphenhydramine. This is Benadryl. So like Advil PM, Aleve PM, and medications used to treat urinary urgency such as oxybutynin, Ditropan XL. So also limit sedatives and sleeping tablets, and talk to your doctor about whether any of the drugs you might take make your memory worse. Complications. Dementia can affect many bodily systems and therefore the ability to function. So dementia can lead to poor nutrition. Many people with dementia eventually reduce or stop eating, affecting their nutrient intake. Ultimately, they may be unable to chew and swallow. Pneumonia. Difficulty swallowing increases the risk of choking or aspirating food into the lungs, which can block breathing and cause pneumonia. Inability to perform self-care tasks. As dementia progresses, it can interfere with bathing, dressing, brushing hair or teeth, using the toilet independently, and taking medications as directed. Personal safety challenges. Some day-to-day situations can present safety issues to people with dementia, including driving, cooking, and walking and living alone. And late-stage dementia results in coma and death, often from infection. Prevention. There's no sure way to prevent dementia, but there are steps you can take that might help. More research is needed, but it might be beneficial to do the following. Keep your mind active. Mentally stimulating activities such as reading, solving puzzles, playing word games, and memory training might delay the onset of dementia and decrease its effects. Be physically and socially active. Physical activity and social interaction might delay the onset of dementia and reduce its symptoms. Aim for 150 minutes of exercise a week. Quit smoking. Some studies have shown that smoking in middle age and beyond might increase your risk of dementia and blood vessel conditions. Quitting smoking might reduce your risk and will improve your health. Get enough vitamins. Some research suggests that people with low levels of vitamin D in their blood are more likely to develop Alzheimer's disease and other forms of dementia. You can get vitamin D through certain foods, supplements, and sun exposure. More study is needed before an increase in vitamin D intake is recommended for preventing dementia. But it's a good idea to make sure you get adequate vitamin D. Taking a daily B complex vitamin and vitamin C also might help. Manage cardiovascular risk factors. Treat high blood pressure. Treat high cholesterol and treat your diabetes. Lose weight if you're overweight. High blood pressure might lead to a higher risk of some types of dementia. More research is needed to determine whether treating high blood pressure may reduce the risk of dementia. Treat health conditions. See your doctor for treatment for depression or anxiety. Maintain a healthy diet. A diet such as the Mediterranean diet, rich in fruits, vegetables, whole grains, and omega-3 fatty acids, which are commonly found in certain fish and nuts, might promote health and lower your risk of developing dementia. This type of diet also improves cardiovascular health, which may help lower your dementia risk. Get good quality sleep. Practice good sleep hygiene and talk to your doctor if you snore loudly or have periods where you stop breathing or gasp during sleep. Treat hearing problems. People with hearing loss have a greater chance of developing cognitive decline. Early treatment of hearing loss, such as use of hearing aids, might help decrease the risk. Oh, and they've got a good many links down here. So, they had a lot more on it than CDC did. So cool. Let's look at things you can do to help your elderly person in your life. Um, let's look at dementia research. Well, all right, let's look at fall prevention first. All right, learn to age without injury. Getting older doesn't mean giving up the activities you enjoy. So, all right, so here's stuff you can do for the older people in your life that might help them to avoid dementia. Because falls always have the risk of head injuries, and you really want to prevent head injuries in older people. You want to prevent them for all ages, but especially for elderly people in your life. So let's look at how to prevent falls. And here's all sorts of stuff directed at your older adults themselves, their caregivers, which might be you, and healthcare providers. So, common injuries as we age. So, let's look at this. Still Going Strong focuses on preventing injuries among older adults because it is a large and growing public health problem facing our nation. Over 10,000 people in the United States turn 65 every day. The number of injuries will increase as the population of older adults grows. Healthcare costs associated with these injuries will also increase. Unintentional injuries have traditionally been the seventh leading cause of death among adults aged 65 and over. Falls and motor vehicle crashes result in the majority of TBI-related hospitalizations, that's traumatic brain injury-related hospitalizations and deaths among older adults. So the top 10 causes of death among older adults are heart disease, cancer, chronic lower respiratory disease, that's lungs, stroke, Alzheimer's disease, diabetes, and unintentional injury. And among unintentional injuries, we've got falls and motor vehicle traffic. So here's about falls. Each year, 36 million falls occur among older adults aged 65 and older. 1 out of 5 falls cause serious injury, such as broken bones or a head injury. Over 950,000 older adults are hospitalized because of a fall injury every year, most often due to a head injury or hip fracture. Hip fracture is your ticket to a nursing home. My grandmother on my dad's side fell in the shower, and she luckily, because she lived alone, luckily her brother was visiting her, but he was hard of hearing, and he could not hear her cries until he actually got up and went in the bathroom and found her. So she laid there for hours in pain, and then she she went to the hospital, and she didn't end up in a nursing home, but nowadays most people would be sent to a nursing home for rehabilitation. More than 95% of hip fractures are caused by falling, and falls are the most common cause of TBI-related deaths and hospital admissions. Every second, an older adult falls, and every year there are 36 million falls with 8 million injuries, 3 million emergency room visits in the hospital, 950,000 hospitalizations, and 32,000 deaths. So preventing falls and fall death rates are on the rise and have increased 30% in the last 10 years. Motor vehicle crashes. There were more than 46 million licensed older drivers aged 65 and older in the U.S. in 2019. That is 1 out of every 5 drivers. This is an increase of 60% since the year 2000. Driving helps older adults stay mobile and independent, but the risk of being injured or killed in a traffic crash increases as we age. So, our vision and ability to reason and remember declines as we age. and physical changes might affect our driving. Certain medical problems increase the risk of car crashes. These include heart disease, dementia, sleep disorders, and limited hearing and vision. Medicines used for sleep, mood, pain, and allergies might affect driving safety. This includes both prescription and over-the-counter medications. Over 8,000 older adults died in traffic crashes, and nearly 252,000 were treated in emergency departments for crash injuries in 2019. 252,000, that's like the population of a large city. This means that each day, 22 older adults are killed and almost 700 are injured in crashes every day. Every day, 22 older adults die in a motor vehicle crash, and every year there are 1.6 million crashes, 250,000 emergency room visits in hospitals, 68,000 hospitalizations, 8,000 deaths. And when you consider with the COVID crisis going on right now, a lot of people are having car accidents and there are no beds in the hospitals because so many are in ICU with COVID when they could have gotten the shots and not been in the hospital. It's terrible. Traumatic brain injury. A traumatic brain injury, or TBI, is an injury that affects how the brain works. It may be caused by a bump, blow, or jolt to the head, or a penetrating head injury, as when an object enters the skull and harms the brain. Not all blows or jolts to the head result in a traumatic brain injury. The severity of a traumatic brain injury may range from mild, moderate, to severe. Most TBIs that occur in older adults are mild and are commonly called concussions. So a TBI is a concussion. Traumatic brain injury deaths are on the rise, about 30% in the past 10 years. And the last figures we have are from 2017. Traumatic brain injury is a major cause of death and disability in the United States. In 2019, there were about 61,000 TBI-related deaths in the United States. Older adults who get a TBI may face health problems that last a few days or the rest of their lives, depending on the severity of the injury. The effects of TBI can include short or long-term problems with thinking and memory, movement, sleep, sensations such as vision or hearing, emotional functioning such as personality changes or depression. TBI is a special health concern for older adults. They have the highest rates of TBI-related hospitalizations and death. Older adults can also take longer to recover from a TBI. Falls and motor vehicle crashes are two leading causes of TBI-related hospitalizations and deaths in older adults. I might add that if you've had a severe TBI in youth, you can often have effects in your old age. I had a bad head injury when I was 9. I was in the ICU unconscious for 2 days and in the hospital for a week. And I noticed after that that I had more falls and I had more trouble learning things. I quickly recovered, but I was still being seen a year after my accident, and it was a fall. It was a simple fall while I was playing. So consider that we really need to reduce fall hazards in our homes because it's a big problem. So I'm going to mark this here because fall prevention is so important. I'll put it there as well. So anybody have any thoughts on fall prevention? And I'm not seeing anything in the chat, so let's go find other ways to prevent falls. Okay. National Institute on Aging. This is a really good resource. So I will put them down here too. And let me get the title of the, Prevent Falls and Fractures. Because fractures are a big deal when you're my age. I've never had a broken bone, but my daughter has. She fell from a chair onto a carpeted floor, but it was a concrete floor, and she fractured her kneecap. And she still has trouble every time it rains. She's limping around the house because when you have a fracture, you develop osteoarthritis in it. So it's important to prevent falls and fractures in all ages, but particularly in older people because it takes a lot longer to heal. A simple thing can change your life, like tripping on a rug or slipping on a wet floor. If you fall, you could break a bone, like thousands of older men and women do each year. For older people, a break can be a start of more serious problems, such as a trip to the hospital, injury, or even disability. If you or an older person you know has fallen, you're not alone. More than 1 in 3 people aged 65 years or older falls each year. The risk of falling and fall-related problems rises with age. Many older adults fear falling. I do. The fear of falling becomes more common as people age, even those who haven't fallen. It may lead older people to avoid activities such as walking, shopping, or taking part in social activities. But don't let a fear of falling keep you from being active. Overcoming this fear can help you stay active, maintain your physical health, and prevent future falls. Doing things like getting together with friends, gardening, walking, or going to the local senior center helps you stay healthy. The good news is there are simple ways to prevent most falls. Causes and risk factors for falls. Many things can cause a fall. Your eyesight, hearing, and reflexes might not be as sharp as they were when you were younger. Diabetes, heart disease, or problems with your thyroid, nerves, feet, or blood vessels can affect your balance. Definitely, I have idiopathic peripheral neuropathy, and that means I don't have full feeling in my hands and feet, my legs. So a lot of nerves in your feet affect how you walk. So I often don't put my foot where I intend to put it. And a lot of that is because of numbness in my feet. So some medicines can cause you to feel dizzy or sleepy, making you more likely to fall. Other causes include safety hazards in the home or community environment. Scientists have linked several personal risk factors to falling, including muscle weakness, problems with balance and gait, and blood pressure that drops too much when you get up from lying down or sitting, called postural hypotension, and I think I have that. Foot problems that cause pain and unsafe footwear like backless shoes or high heels can also increase your risk of falling. Confusion can sometimes lead to falls. For example, if you wake up in an unfamiliar environment, you might feel unsure of where you are. If you feel confused, wait for your mind to clear or until someone comes to help you before trying to get up and walk around. Some medications can increase a person's risk of falling because they cause side effects like dizziness or confusion. The more medications you take, the more likely you are to fall. I used to be on 14 and I cut them down to 7. Um, Take the right steps to prevent falls. If you take care of your overall health, you may be able to lower your chances of falling. Most of the time, falls and accidents don't just happen. Here are a few tips to help you avoid falls and broken bones. Number 1, stay physically active. Plan an exercise program that is right for you. I walk from my bedroom to the living room, and that may seem like too little to matter, but it's what I can do, right? And I'm starting out small and trying to work up to walking around my neighborhood like I did before I had um, major surgery last year. I had to have my appendix out, and it was an emergency thing, and it did rupture, and it has taken a long time to recover. And then I got COVID in December, and I've had ongoing just awful fatigue and just it's very, very hard to get up and walk now. So I'm starting out small. I'm walking from the bedroom to the living room and seeing how many times I can do that and increase it by once a day. And so far, I'm having mixed results, but yesterday I walked 3 times. So I'm still working with that. But any activity you can do is good and you should do it. Um, Definitely regular exercise improves muscles and makes you stronger. It also helps keep your joints, tendons, and ligaments flexible. Mild weight-bearing activities such as walking or climbing stairs may slow bone loss from osteoporosis. A lot of older women get osteoporosis. Have your eyes and hearing tested. Even small changes in sight and hearing may cause you to fall. When you get new eyeglasses or contact lenses, take time to get used to them. Always wear your glasses or contacts when you need them. If you have a hearing aid, make sure that it fits well and wear it. Find out about the side effects of any medicine you take. If a drug makes you sleepy or dizzy, tell your doctor or pharmacist. Anytime I get my medicine filled at the pharmacist, I get a little sheet that tells me about the side effects that are possible with every medication I take. And every once in a while, I go through those. If I start a new medicine, I read it immediately before I take it so that I know what it's likely to do and what it may do. And it's it's just good to have that general knowledge. So, oh, if I'm feeling this symptom, well, it might be the whatever medicine. And get enough sleep. If you're sleepy, you're more likely to fall. And limit the amount of alcohol you drink. Even a small amount of alcohol can affect your balance and reflexes. Studies show that the rate of hip fractures in older adults increases with alcohol use. Stand up slowly. Getting up too quickly can cause your blood pressure to drop. That can make you feel wobbly. And sometimes I forget. My mind is 16. My body is 62, and sometimes I forget and get up too fast, but I'm always holding on to something. So if I get a little dizzy, I can just hold on to whatever or even sit back down. And sometimes I do that. But it's always good to be holding on to something when you're walking around if you are prone to falls, and I am a fall risk. So, you know, be nice to yourself. Stand up slowly. Use an assistive device if you need help feeling steady when you walk. Appropriate use of canes and walkers can prevent falls, and I do use a walker or even the wheelchair to go to the doctor. If I'm feeling bad, I use the wheelchair because I'm a lot more likely to tip the walker over and fall. So know your body and, you know, use your assistive equipment. It is a hassle to put it in the car, but it is much better to avoid a fall. Um, if your doctor tells you to use a cane or walker, make sure it's the right size for you and the wheels roll smoothly. This is important when you're walking in areas you don't know well or where the walkways are uneven. A physical or occupational therapist can help you decide which devices might be useful and teach you how to use them safely. And especially if you buy yourself a cane or a walker, do adjust it and watch the directions on it, and if those directions aren't clear, look up a resource on the internet because it is worse for you to use a cane that's too short or too tall than it is to have it adjusted to the right height for your body. And there are resources on the internet to help you adjust it to the right height so it feels good and so it works correctly. Sometimes what feels the best is not the best, so be sure and read up. Be very careful when walking on wet or icy surfaces. They can be very slippery. Try to have sand or salt spread on icy areas by your front or back door. And even in the South, we don't think about things like that, but it's good to have a container of ice melt right by your door so that you will see it when you go out and remember to use it. Wear non-skid, rubber-soled, low-heeled shoes or lace-up shoes with non-skid soles that fully support your feet. I am very careful. I wear walking shoes, and you can often find them very cheaply at Walmart. They're a lot of times they're on clearance, and I always have a pair of tennis shoes with thick soles that support my feet well. And that way I don't have to worry about slick shoes because if you're wearing those thin-soled shoes with the slick leather soles, you're asking for a fall. It's important that the soles are not too thin or too thick. Don't walk on stairs or floors in socks or in shoes and slippers with smooth soles. I always, when I get slippers, I get the ones with the rubber bottoms that have the ridges. That way it's non-skid. Always tell your doctor if since your last checkup, even if you aren't hurt when you fall. A fall can alert your doctor to a new medical problem or problems with your medications or eyesight that can be corrected. Your doctor may suggest physical therapy, a walking aid, or other steps to prevent future falls. What to do if you fall? Whether you are at home or somewhere else, a sudden fall can be startling and upsetting. If you do fall, stay as calm as possible. Take several deep breaths to try to relax. Remain still on the floor or ground for a few moments. This will help you get over the shock of falling. Decide if you are hurt before getting up. Getting up too quickly or in the wrong way could make an injury worse. If you think you can get up safely without help, roll over onto your side, rest again while your body and blood pressure adjust. Slowly get up on your hands and knees and crawl to a sturdy chair. Put your hands on the chair seat and slide one foot forward so that it is flat on the floor. From this kneeling position, slowly rise and turn your body to sit in the chair. If you are hurt or cannot get up on your own, ask someone for help or call 911. If you are alone, try to get into a comfortable position and wait for help to arrive. Carrying a mobile or portable phone with you as you move about your house could make it easier to call someone if you need assistance. An emergency response system, which lets you push a button on a special necklace or bracelet to call for help, is another option, and I have one of those. And what's neat about those panic buttons is that you push the button, it does not call 911, it calls the company you got it from, and they ask, "Are you okay?" And then they'll check your address with them. And they will also, you know, ask if you're all right. And if you're just testing the unit, then you say, "I am just testing my unit, and I have to test it once a month. But if I need help, then I can say, 'Oh, I've fallen and I can't get on my feet and I'm alone here,' and they can send an ambulance. Or if you've got a prowler outside your window, you can ask them to call the police for you. Whatever help you need, that is as close as pushing that button. And if you would rather, you could have them call a relative to come check on you. So that's an option too. So don't be hesitant about those panic buttons. They are really nice. And if you get Meals on Wheels, oftentimes you can get one free of charge. That's in addition to your Meals on Wheels and your Care Aid in some programs. So it's good to talk to your social worker or your case manager if you haven't got a panic button and you would like one. It The newer ones are wireless, so if you're out of the home, say you get a friend to drop you off at the grocery store, and if you have a problem, you can push that push button wherever you are and get help. So it's important to, and they can tell where you are from the location information in the device. So it's a very good thing for um, an elderly person that you maybe are not living in the house with them and you want to make sure they're okay. Then that's a good way to make sure you are notified if they have a problem. So having healthy bones won't prevent a fall, but if you fall, it might prevent breaking a hip or other bone, which may lead to a hospital or nursing home stay, disability, or even death. Getting enough calcium and vitamin D can help keep your bones strong. So can physical activity. Try to get at least 150 minutes per week of physical activity. Other ways to maintain bone health include quitting smoking and limiting alcohol use, which can decrease bone mass and increase the chance of fractures. Also, try to maintain a healthy weight. Being underweight increases the risk of bone loss and broken bones, so you don't want to be underweight or overweight. You want to be right in the middle. Osteoporosis is a disease that makes bones weak and more likely to break. For people with osteoporosis, even a minor fall may be dangerous. Talk to your doctor about osteoporosis. Learn how to fall-proof your home. And here's more information. So Let's learn how to fall-proof the home. So we'll put this under fall prevention. Well, put it here. Okay, so I'll put that here. Let's learn more about fall prevention. Okay, 6 out of every 10 falls happen at home, where we spend much of our time and tend to move around without thinking about safety. There are many changes you can make to your home that will help you avoid falls and ensure your safety. In stairways, hallways, and pathways, have handrails on your stairs on both sides. Make sure they're tightly fastened. Hold the handrails when you use the stairs, going up or down. If you must carry something while you're on the stairs, hold it in one hand and use the handrail with the other. Don't let what you're carrying block your view of the steps. Make sure there's good lighting with light switches at the top and bottom of stairs and on each end of a long hall. Remember to use the lights. Keep areas where you walk tidy. Don't leave books, papers, clothes, and shoes on the floor or the stairs. Check that all carpets are fixed firmly to the floor so they won't slip. Put no slip strips on tile and wooden floors. You can buy these strips at the hardware store. Don't use throw rugs or small area rugs. In bathrooms and powder rooms, mount grab bars near toilets and on both the inside and outside of your tub and shower. If you rent or live in a place where you can't mount stuff, there are portable grab bars that you can get that are very sturdy. I use one because we rent here. So I have one in my tub, and I also have a shower chair that and it has arms on it. So I have something to grab. And on my toilet, I have a riser frame that also has arms, so I can hold on to that while I'm sitting down and getting up. So these are very, very helpful, and you don't have to use a drill or know how to avoid wiring in the wall or anything like that. You just buy the device and just set it over your toilet, and it's got arms on it. It's a metal frame. So things like this can help you if you live in a rental place and you don't have your own home. And place non-skid mats. I have one of those in my bathroom. Strips or carpet on all surfaces that may get wet. Remember to turn on night lights. I have a night light in the bathroom that comes on automatically when it gets dark, so I never have a dark bathroom. These little things are little, but they mean a whole lot. It's very good to have enough light to be able to move around the house, and it's good to keep clutter out of your walkways. You need 36 inches. So if you think as you walk through your house, maybe you're getting your house ready for an elderly person to come live with you, you want to look at every walkway in your house and make sure there is 36 inches of clearance along the entire path, so that a person using a walker or a wheelchair or even a cane can maneuver without having obstacles in the way, because it's harder to move your feet out of the way of an obstacle. It's just better not to have those obstacles there. So remember to turn on night lights. If you get the kind with the electric eye, they will turn on automatically when the light gets to a lower level, so that way you've got night lights everywhere you need them. In your bedroom, put night lights and light switches close to the bed. Keep a flashlight by your bed in case the power is out and you need to get up. Keep your telephone near your bed. I always keep my cell phone within reach, and that way I've got light too. In other living areas, keep electric cords and telephone wires near walls and away from walking paths. You can get little hooks to hook things up near the ceiling if you've got a long run of wire, say your internet wire from your router to your bedroom. It's very easy to put these little hooks up, and that way, and you can get the kind that are non-destructive that have adhesive on them, and then you don't have trouble from your landlord for putting holes in the walls. So there are ways to get those cords out of the floor. Secure all carpets and large area rugs firmly to the floor. Again, those self-stick pads are wonderful. Arrange your furniture, especially low coffee tables and other objects, so they are not in your way when you walk. Make sure your sofas and chairs are the right height for you to get in and out of them easily. And that can be as simple as buying a device or a cushion to make them higher, or a device that actually has a seat that raises to help an elderly person get up. And there are chairs that are built this way too, with this mechanism that can give them an assist getting up. Don't walk on nearly washed floors. They are slippery. Yeah, I'm very careful about that when we mop. We usually use a Swiffer to mop with, and we just spray bleach spray on the floor and then mop it immediately, and then the floors are never wet. Keep items you use often within easy reach. Don't stand on a chair or table to reach something that's too high. Use a reach stick or ask for help. Reach sticks for special grabbing tools like this, and it has a handle down here and a grabber on this side, and it also has a magnet up here. So I can grab some things, like I was trying to get my ink pen off the floor earlier, and it had a clip that was attracted to the magnet. So even though I couldn't quite grab it with the grabber, I was able to get it with the magnet. So reach sticks are wonderful things. I call mine the grabber, but whatever you call it, it's a good thing. Don't let your kids or grandkids play with it, because they will break it. They are fun to use, but they are very easy to break, like most disability equipment. If you use a step stool, make sure it is steady and has a handrail on top. Have someone stand next to you. Don't let your cat or dog trip you. Know where your pet is wherever you're standing and walking. Usually they learn after they get their paws stepped on a few times to avoid you, but ours still rush in front of me sometimes, and I just stand still until they're through moving through and then go. But it is possible to train them. I have my service dog trained so that when I'm walking through, I tell him, Aki, go over there. And I point to over there, and he goes and he sits there. So definitely a little training is a good thing. Keep emergency numbers in large print near each telephone. Well, I can't do that with a cell phone. I don't have a line phone anymore. But if you have a line phone, it's good to tape those emergency numbers right there. And it might be good to keep a list of emergency numbers taped to the wall or programmed into your phone so that you have an emergency number to call. If you have fallen, your doctor might suggest that an occupational therapist, physical therapist, or nurse visit your home. These healthcare providers can assess your home's safety and advise you about making changes to prevent falls. Your own medical alarm. If you're concerned about falling, think about getting an emergency response system. If you fall or need emergency help, you push a button on a special necklace or bracelet to alert 911. Mine is being charged at the moment. That's why I'm not wearing it. There's a fee for this service, and it's usually not covered by insurance. I think it should be, but there are programs that cover it if you for example, if you get home care, then usually it will be part of that package that you can request. So, but definitely, even if you have to pay for it, it's worth it to just be able to um, push a button, and there's always someone on the other line 24/7 who can talk to you and find out what your emergency is. And many state and local governments have education and or home modification problems to help older people prevent falls. Check with your local health department or a local area agency on aging to see if there's a program near you. So, good stuff. So let's go over to the area agency on aging. And this is a great general resource that is available to everybody. Oh, and this is how you find the one nearest to you. So I will put this here. And that way you can find out about all the local agencies that help if you have an elderly person that you've taken into your home, or if you've got a loved one who's a senior and maybe they live alone and you're worried about them. So this is ways that you can find out more about aging resources. So you just put your city and your state and zip code and do a search. And I'm just putting mine in for an example. And in my area, there's the Northwest Georgia Regional Commission Area Agency on Aging. And there's all sorts of resources. And the Aging and Disability Resource Connection, Georgia Division of Aging Services. Your state probably has something similar. And Elder Abuse Prevention, Georgia Adult Protective Services, Department of Community Health, Healthcare Facility Regulation, if you've got a person living in a nursing home or a longer term care facility, and the Georgia Cares program can help you with picking a Part D, for example, for your Medicare. Part D has to do with your prescriptions. So there are many different private insurance companies that provide your Part D, and they can also provide your Part A and B, which is your hospitalization and outpatient care from your Medicare, sorry. So, in your Medicare, that's the health insurance you get when you turn 62, and it takes a couple of years for it to kick in. So don't expect that the minute you're 62, you're going to have this health insurance. I don't know why there's that delay. I think it's ridiculous. But when you actually do pass your date, whether it's 2 or 3 years later, then you get your Medicare and you get those benefits. That's why I think that they should have Medicare for all, so that you don't have a 2-year waiting period, and everybody should be able to get these benefits. It gives you a physical every year, and it helps you with the cost of prescription medicines. So, and it will give you legal services too, in case you've got, pretty much any service that you could possibly need. They try to have resources on it. And there's long-term care planning, and probably as part of the long-term care planning, there's probably a link to the living will. So that's just an example of what you can find from this site. So I encourage you that if you've got an elderly person in your life, that you check into this to help them get the services they need. So, now let's see. I was going to go into something else. Let's go back. So, okay, so let's go back. Before I was looking up fall prevention, I was going to look at research. Yeah. So let's look at the cutting edge research that is going on. In 2021. Okay, what's exciting the experts? Let's take a look at medical news today. And I will put this here. Always good to have hope for the future. And scientists are always investigating what can we do to live longer. So let's look at the dementia research and see what's exciting the experts. So I'll put this here and let's see what is going on. June is, of course, it's not June now, it's August, but June was Alzheimer's and Brain Awareness Month. So here's news from a number of dementia experts who were asked what recent research they find most exciting. By 2030, the WHO, they say around 50 million people have dementia worldwide. There are about 10 million new cases each year. So by 2030, we're going to be looking at 82 million people with dementia globally, and by 2050, that figure may reach 152 million. Currently, no treatment can cure dementia. Dementia research focuses on understanding how the condition works, why it develops, and how it might be treated. Importantly, there's also a focus on how we can improve the lives of people with dementia. So, approaching protein misfolding. At the center of many types of dementia is protein misfolding, and it is clear that this plays a key role in the disease progression, explained Professor Louise Serpell, director of Sussex Neuroscience, a community of more than 50 neuroscience research groups at the University of Sussex in the United Kingdom. Protein misfolding occurs when a normally functional protein, such as tau, changes its shape and aggregates to form long filaments that are deposited in brain tissues. Several types of dementia, including Alzheimer's disease and Pick's disease, involve the misfolding of a protein called tau. In Alzheimer's, these structures are known as neurofibrillary tangles. I'll get it right in a minute. Serpell, a professor of biochemistry, noted that the misfolding of this protein is an important therapeutic target because of the wide range of diseases that involve tau. The key to understanding and combating protein misfolding and aggregation is identifying a suitable model system that mimics misfolding. Scientists can then use this model to test hypotheses and pharmaceutical approaches. Work in Professor Serpell's laboratory, in collaboration with the pharmaceutical company TARX, has identified a protein fragment that forms paired helical filaments that are similar to those formed in the brains of people with Alzheimer's disease. Using this model, scientists can more easily investigate ways of reversing the misfolding. Professor Serpell continued, small molecules and antibodies are being developed that can prevent tau aggregation. One of these is known as a tau aggregation inhibitor, which was designed by TARX and has reached phase 3 clinical trials as a monotherapy, offering hope for a disease-modifying treatment. Wonderful. Material citizenship. Dr. Kellen Lee is a chartered psychologist and research fellow. Now, did I put this in the chat? Yes, I did. Okay, and just checking. There we go. Okay. She's a chartered psychologist and research fellow in aging and dementia at the University of Southampton in the UK. She uses everyday household items as the focal point of new innovative training focused on risk enablement in care homes. The aim of this training, called the Material Citizenship Framework Project, is to educate staff on the importance of objects in everyday life and how to include objects in care assessments and care planning. This sounds interesting. The program grew from Dr. Lee's PhD research, which found that residents with dementia often move directly from hospitals into care homes, providing little or no opportunity to return home and choose which possessions to bring with them. Once in care homes, people with dementia are rarely involved in decisions about their possessions. They lack control over what they have and are often discouraged from interacting with things that are important in maintaining their identity. That's awful. Dr. Lee explained to Medical News Today, material citizenship goes beyond just looking at the person's medical needs, but revisits how that person lived their everyday life before they went into a care home, including the objects they used to carry out certain tasks and what kinds of routines and rituals they do every day that we can help them maintain. Losing access to frequently used possessions can cause disempowerment and confusion. To observers, this confusion can sometimes seem like dementia progression. The following example underlines the importance of objects. Judy would say she didn't recognize herself when looking in the mirror. Care staff believed this was a symptom of dementia. However, it was because her hair was gray, and before she moved to the care home, she dyed it blonde. She also had straight, flat hair, but before moving into the care home, she would use her curling tongs to curl her hair. Dr. Lee told MNT that care home staff training sessions have been amazing. Staff feel valued, and they say that material citizenship gives them a safety net to the point where they say one of our residents really wanted to polish her own room with a particular polish. Initially, this was seen as unnecessary. The cleaning staff were there to clean. But now we've got her the polish she wanted. She polishes her room and it makes it smell like home. As this work highlights, understanding the biology behind dementia is urgent, but understanding how to enhance the lives of those currently living with dementia is equally pressing. Cool. Finding ways to enrich the lives of people with dementia is a crucial element of ongoing research. Definitely. Sports and dementia. There's been a lot in the media around sport and dementia risk, but we don't have enough clear answers, so research is vital for current and former players and their families who need to be provided with the most up-to-date information, explained Dr. Richard Oakley, head of research at Alzheimer's Society in the UK. In an ongoing study, Dr. Oakley and colleagues are focusing on rugby players. We have provided funding for 50 former elite rugby players to join the Prevent RFC study, run by Professor Craig Ritchie at the University of Edinburgh and Professor Willie Stewart at the University of Glasgow. This new study forms part of the large-scale world-class Prevent program looking at the early warning signs of dementia. The rugby players are joining 700 participants already enrolled and will undergo brain scans, comprehensive physical health checks, lifestyle questionnaires, and blood tests, among other assessments. By recruiting former elite rugby players, the researchers hope to see whether they show more early warning signs of dementia than the general population, and if so, whether these are associated with greater exposure to injury during the players' careers. Dr. Richard Oakley. Because the scientists are still exploring how and why dementia develops, studies such as this may provide vital insight into the early stages of the condition. I think they ought to include other sports such as American football, soccer, and other sports that have high numbers of head injuries. The value of a hug. A hug is a soft comforter designed to be cuddled by people living with advanced dementia. It has weighted limbs and a simulated heartbeat, as well as the ability to play the person's favorite music. Ah, Simon Lord, the Innovation Program Manager at Alzheimer's Society, explained. A hug is much more than a cuddly toy, Lord continued, noting that research led by Professor Kathy Treadaway at Cardiff Metropolitan University has shown that hugs can improve quality of life and reduce anxiety and agitation for people in the latter stages of dementia, providing the comforting sensation of giving and receiving a hug. That's cool. This type of empathic innovation can make a real difference for people with dementia. There is little available to reduce anxiety in people with advanced dementia. Such a simple product can make a huge difference to someone's well being, especially after the extremely damaging side effects of lockdown, long periods of isolation, and a loss of social interaction and the comfort of human touch. Simon Lord. Diabetes drug for Alzheimer's. Dr. Oakley of Alzheimer's Society is also excited about another ongoing study funded by the organization. This involves the diabetes drug metformin glucophage. He told MMT, Dr. Teresa Nicoli at University College London in the UK is looking into metformin, a drug for type 2 diabetes, which has shown promise in some studies for improving symptoms of Alzheimer's. The improvement in symptoms has been observed in a small scale clinical trial for Alzheimer's as well as in fruit fly studies. However, as is often the case with medical research, all that glitters is not gold. Dr. Oakley explained, metformin treatment has also been shown to increase the buildup of amyloid deposits, which are known to be associated with Alzheimer's. It's clear that we need to better understand how metformin works and whether it could be a potential treatment for Alzheimer's. The researchers are using fly models of Alzheimer's disease to identify genes that affect metformin treatment without the buildup of amyloid deposits. In the one study, for instance, Dr. Nicoli and colleagues used an adult-onset fruit fly model that mimicked Alzheimer's. They found that metformin rescued the fly's nervous system from some of the toxic effects. They also identified that the suppression of a protein called Group 78 was important in this activity. I think GRP would be group. Maybe not. GRP 78. The authors conclude that GRP 78 could be a novel therapeutic target for the treatment of Alzheimer's disease. The next steps, Dr. Oakley noted, are to look at the genes in human brain cells that are affected by Alzheimer's disease to see if similar effects are observed. We have no cure for Alzheimer's, so drugs to stop or slow down its progression are vital. Dr. Oakley concludes, repurposing drugs that are already used is a great place to start. We can learn how these drugs work, then develop more targeted treatments without unwanted side effects. And Catherine Hall says, for me, the most exciting avenue of research into dementia is the interface between the brain's blood supply and the emergence of neurodegeneration and cognitive decline. Dr. Catherine Hall is a senior lecturer in psychology at the University of Sussex. We've known for a long time that dementia and cardiovascular disease share risk factors. J.C. de la Tour put forward the vascular hypothesis of Alzheimer's disease 30 years ago after connecting damage to the small blood vessels in the brain with the decreased blood flow and impaired energy use seen in dementia patients. However, Dr. Hall explained, scientists only fairly recently discovered That decreased blood flow happens well before any of the classic Alzheimer's disease pathology, such as beta amyloid buildup, tau tangles, and cognitive decline. This implies that decreased blood flow might actually cause dementia to occur. Dr. Hall described how this reduction might lead to Alzheimer's. Toxic proteins such as beta amyloid build up more in the low oxygen conditions that are created when the blood supply is lowered. Also, these proteins constrict blood vessels to further worsen the blood supply, creating a vicious cycle that could lead to neuronal damage and cognitive decline. However, questions remain. We don't know how the brain switches from unhealthy but coping to undergoing neurodegeneration. Factors that might be involved are age, infection, trauma, and lifestyle factors, including an unhealthy diet and lack of exercise. Although more work is needed, Dr. Hall believes that probably these risk factors gradually impair how blood vessels work in our brain until suddenly our neurons stop working. My lab's recent work shows that the brain's memory center, the hippocampus, normally has much lower blood oxygen levels than the sensory cortex and is less able to regulate its blood supply by dilating blood vessels. Based on this finding, Dr. Hall and her team predict that while the sensory cortex might deal with alterations to blood flow more easily, the hippocampus is at a tipping point where a small nudge will reduce brain oxygen to levels that stop neurons working so well. This might explain why memory problems are some of the first symptoms of Alzheimer's disease. So Dr. Hall explained that scientists need to carry out more research to test the prediction that a small decrease in blood flow is catastrophic for the hippocampus, and to understand the exact pathways that link a decrease in flow with classic Alzheimer's disease damage in order to discover new treatments. Until then, she recommends that we keep our hearts and blood vessels healthy with a good diet and exercise to keep the blood flowing properly to the brain. Reaching the end. In a society aging with dementia, research is essential to establish the causes, therapies, medication, and cures which can support families affected by the condition, said Dr. Karen Harrison Denling, head of research and publications at Dementia UK. She explained to MNT, "At Dementia UK, we know there are thousands of people living with dementia right now. As such, more focused research into dementia care, which acknowledges needs and values individuals' experiences, can provide access to high-quality support from diagnosis through to bereavement." Dr. Karen Harrison Denning. In line with this, Dementia UK is partnering with the University of Kent in the UK to uncover what makes a good death in dementia care. The project seeks to inform policy development about death and dying in dementia, which is right now predominantly seen through a clinical lens rather than a person-centered one. Hearing from people with the diagnosis of dementia is a key aim of this study. The take-home message: scientists are working tirelessly to find better ways to treat and manage dementia, but there is still a long road ahead. Dr. Oakley from Alzheimer's Society told us, "Decades of underfunding in dementia research means that it can be difficult to make progress. The UK government must keep their commitment to double dementia research funding. With financial support, research will beat dementia." And I might say that we need the same in the US. Okay, so there's lots of good articles in this resource. Medical News Today. Let's go to their About Me page so that we know what this resource is. And the art in it was by Diego Sabagal. So let's go to the Knowledge Center, and they should have an About Us page. Yeah. Okay, as an organization, MMT strives for a deeper understanding of health. Medical News Today, part of Red Ventures, is one of the fastest growing health information sites in the United States. Every month, more than 85 million people from across the globe come to Medical News Today for our in-depth health information and the latest news in medical research. So, I hope I didn't violate the copyright by going on this site, but the article was very good and very well written, so I just wanted to, and this article was written by Tim Newman on June 17th, 2021. So I properly credited them. And let's go back to some of the government sources where I don't have to be quite as careful about copyrights. There are a lot of things about research, but let's look at this article from UCSF, University of California, San Francisco Educational. Okay, the brain cells most vulnerable to Alzheimer's are identified by scientists. Findings could lead to targeted treatments to boost the brain's resilience by Nicholas Weiler. A major mystery in Alzheimer's disease research is why some brain cells succumb to the creeping pathology of the disease years before symptoms first appear, while others seem impervious to the degeneration surrounding them until the disease's final stages. Now, a study published January 10th, 2021 in Nature Neuroscience, a team of molecular biologists and neuropathologists from the UCSF Weill Institute for Neurosciences have joined forces to identify for the first time the neurons that are among the first victims of the disease, accumulating toxic tangles and dying off earlier than neighboring cells. We know which neurons are first to die in other neurodegenerative diseases like Parkinson's disease and ALS, but not Alzheimer's, said co-senior author Martin Kempman, PhD, an associate professor in the UCSF Institute for Neurodegenerative Diseases and Chan Zuckerberg BioHub investigator. If we understood why these neurons are so vulnerable, maybe we could identify interventions that could make them and the brain as a whole more resilient to the disease. Alzheimer's researchers have long studied why certain cells are more prone to producing the toxic tangles of the protein known as tau, whose spread through the brain drives widespread cell death and the resulting progressive memory loss, dementia, and other symptoms. But researchers have not looked closely at whether all cells are equally vulnerable to the toxic effects of these protein accumulations. So, the belief in the field has been that once these trash proteins are there, it's always game over for the cell. But our lab has been finding that's not the case, said Lee Grinberg, MD, the study's other senior author, an associate professor and John Douglas French Alzheimer's Foundation endowed professor in the UCSF Memory and Aging Center. Some cells end up with high levels of tau tangles well into the progression of the disease, but for some reason don't die. It has become a pressing question for us to understand the specific factors that make some cells selectively vulnerable to Alzheimer's pathology, while other cells appear to resist it for years, if not decades. To identify selectively vulnerable neurons, the researchers studied brain tissue from people who had died at different stages of Alzheimer's, obtained from the UCSF Neurodegenerative Disease Brain Bank and the Brazilian Biobank for Aging Studies, a unique resource co-founded by Grinberg. The Sao Paulo-based biobank collects tissue samples from a broad population of deceased individuals, including many without a neurological diagnosis whose brains nevertheless show signs of very early-stage neurodegenerative disease, which is otherwise very difficult to study in humans. First led by Campman Lab MD PhD student Kun Ling and PhD student Emmy Lee, the study's co-first authors, the team studied tissues from 10 donor brains using a technique called single-nucleus RNA sequencing, which let them group neurons based on patterns of gene activity in a brain region called the entorhinal cortex, one of the first areas attacked by Alzheimer's. The researchers identified a particular subset of neurons that began to disappear very early on in the disease. Later on in the course of the disease, the researchers found a similar group of neurons were also first to die off when degeneration reached the brain's superior frontal gyrus. In both regions, these vulnerable cells were distinguished by their expression of a protein called RORB. This allowed researchers in Grinberg's neuropathology lab, led by former lab manager Raina Ezer, to examine RORB expressing neurons in more detail in brain tissue from a larger cohort of 26 donors. They used histological staining techniques to examine the fate of cells from both healthy individuals and those with early and late stage Alzheimer's. This work validated that RORB expressing neurons do in fact die off early on in the disease and also accumulate tau tangles earlier than neighboring non-RORB expressing neurons. These findings support the view that tau buildup is a critical driver of neurodegeneration, but we also know from other data from the Grinberg lab that not every cell that builds up these aggregates is equally susceptible, said Ling, who plans to continue to study factors underlying RORB neurons' selective vulnerability using CRISPR-based technology the Campman lab has developed. It's not clear whether RORB itself causes the cell's selective vulnerability, researchers said, but the protein provides a valuable new molecular handle for future studies to understand what makes these cells succumb to Alzheimer's pathology and how their vulnerability could potentially be reversed. Our discovery of a molecular identifier for these selectively vulnerable cells gives us the opportunity to study in detail exactly why they could succumb to tau pathology and what could be done to make them more resilient, Ling said. This would be a totally new and much more targeted approach to developing therapies to slow or prevent the spread of Alzheimer's disease. Targeted is good. The authors, Grinberg and Kempman, are both faculty members of the Department of Neurology in the UCSF Weill Institute for Neurosciences. Additional authors on the study, and there's a whole list of them. Wow. The research was supported by the U.S. National Institutes of Health. And there was an Alzheimer's Association fellowship and a lot more. And the authors declare no competing interests. So this is interesting stuff. It's a little technical, but it's very, in other words, the findings could lead to targeted treatments to boost the brain's resilience. So definitely, there's a lot of good research that gives us hope that, and there's dementia research and clinical trials. Scientists are making great strides in identifying potential new ways to help diagnose, treat, and even prevent Alzheimer's and related dementias. These advances are possible because thousands of people have participated in clinical trials and other studies. So, if you're looking for Alzheimer's disease and related dementias clinical trials, visit the alzheimers.gov clinical trials finder. So I will put a link to this. And that way, if you know somebody who would like to participate in a clinical trial, then you can give them this link. So I'll go ahead and put this here. Alrighty. I'll just put their little bit at the beginning. And here's, yeah, so if you know anyone who might like to participate in a clinical trial, then you can give them that link. So I'm going to bring this to a close. Dementia is a terrible thing. I watched a friend of mine die of it, and she died very quickly, which was unusual, but she had some obvious bruises on her face from falls, and unfortunately, the pads that should have been under her bed were not placed in the nursing home, and charges were, were brought up against the nursing home. But because she died in the middle of that, I don't think it was continued, which is very sad. Dementia is a horrible thing, and the overcrowding of nursing homes is a very severe problem in our country. And as you can tell from the outbreaks of COVID in nursing homes, it is extremely difficult for the staff to keep up with the number of infections. And we should have smaller, more local nursing homes. I visited a nursing home in Cuthbert, Georgia in 2014. And I wanted to talk to some older folks that used to live in Cuthbert. I couldn't find a single one. All of the people in the Cuthbert nursing home, which was operated by the hospital, were from other places, sometimes other states. It's ridiculous that a lot of people expect that they'll be able to find a nursing home to put their mother or their relative in that's nearby so they can go and visit. And a lot of times they are shipped off to another county or even another state. It's a ridiculous thing. And I visited Judy at the nursing home that she was in, and there were 3 people to a room. You could not get a Hoyer lift into those rooms. So that meant the staff were getting back injuries because they could not use a Hoyer lift, which is a piece of equipment to lift someone who's had a stroke. Maybe one half of their body is paralyzed. They can't help you lift them. And to have people lifting these folks is injuring their backs, and they're having to be disabled or quit the profession. It is terrible that so many good workers are lost to back problems. This is preventable. We need to not have more than 2 people to a room in a nursing home. I think it is ridiculous to expect they're going to get quality care when there are 3 people in a room. When I was in a nursing home in 2003, I was scared to death. There was no security guard at the front desk. Families were asking for the door to stay open until 9:30 at night. Everybody was walking in off the street, and there were people going after the people in comas, pain patches. I overheard nurses talking about this, and it terrified me. I heard everything being discussed at the nurse's desk because it was right outside my door. And this was supposedly a high quality nursing home. I met the director. I liked him. I thought he was a good man. But there were things going on at that nursing home that I did not like. I was afraid to call the 800 number because I was living there. So I just want to say that it is much better for us to be cared for in our homes rather than in nursing homes. My personal opinion is I would rather die than go into a nursing home. I would rather be cared for at home, and I am in a program that does just that. So now my daughter is paid to take care of me so that I don't have to go in a nursing home. But if it ever got to the point that she could not physically care for me at home, there would be no other choice. There's no other relatives who could take me. So a lot of families are in this situation, or they live in a city that is far from their relatives or anybody who could help, and maybe they're tied to that city because of a job. You know, we need to have more options for people. I, for one, am very happy to see the robot revolution speeding up because of COVID, because maybe someday there will be robots that can lift a person carefully and gently without hurting them, to transfer them from bed to toilet to whatever's required, or even to carry them around for walks. I would love to be carried by a robot. I think that would be so cool. And be able to be eye level with whoever's walking with me. So I am encouraged by a lot of the robotics that have come out in the last year. There's Timmy, which is a robot that can be fitted with a lot of medical devices. So it can monitor your blood pressure, your heart rate, your temperature, and contact your doctor for you if they think something is concerning. There are many medical robots that have human-like features, and the industry is booming right now. There's a lot of research, and they've got AIs that actually do work on a rudimentary level. So, not like the robots of the Jetsons or ideas we grew up with in the 60s that we thought we would have by now. But definitely there are many advances that could benefit elderly people in their homes. If you could buy a robot to be with grandma, then maybe she could stay in her home where she's most comfortable for longer and yet keep track of what the family's doing. And the family could call the robot to check in on her and do two-way video communication through Zoom or other softwares. The possibilities are endless. So I'm very happy to see advances in robotics and in general help around the home. I have Alexa and I have the Google Assistant, and having them nearby to help me can automate a lot of things that I would normally have to get up and do. So definitely there is technology that helps with all kinds of disabilities, but particularly if you have someone with dementia, you definitely want, if they're still at the point that they can live independently safely, if you had something like an Alexa or a Google Nest or a Google Hub or other devices, then you could drop in every once in a while and say, "Grandma, are you doing okay?" And just to make sure that everything's all right there. So definitely there are a lot of things that you can do for your dear one that might have Alzheimer's. And if you're worried about Alzheimer's, do talk with them and see if you can get them to go to the doctor and, if possible, go with them. It's important that there are two of you in the doctor's appointment to hear what goes on. I always take my daughter with me to doctor's appointments now because I forget a lot of the vital details. And with two of us listening and one taking notes, then I'm more likely to remember what the doctor tells me to do. So it's important, even if your loved one doesn't have Alzheimer's, because it is true that as you get older, it's harder to find words for things and it is harder to remember small things. Part of that is because your brain just gets full of experience and it's harder to shove more information in. It takes a little more effort as you get older to memorize things. So it is good to have these electronic minders that can keep track of some of these bits of information, and especially any directions you've got for medications and reminders to take them, to get your medicine in you every day so it can do its job. compliance is a major issue. Any pharmacist will tell you that when a doctor prescribes a medication, a lot of people don't take it properly. So this is not confined to just older Americans, but whatever it takes, a medicine is not going to do you any good sitting in the bottle while you miss doses. And if you have fears about a medication, talk to your doctor. Medicine is a teamwork between you and your medical professionals. And it's very important to have that communication between you and your provider. If you don't feel comfortable talking to your doctor, find another doctor. Sometimes there may be a personality conflict or something that's not the doctor's fault and it's not your fault, but you need somebody that you feel comfortable talking to. And that's going to differ for every person. So it's important if you have a doctor or other medical professionals, maybe a physical therapist, occupational therapist, you've got people in your lives that are on your medical team. You might even have a psychologist and psychiatrist on board. So you've got to be comfortable with all these medical professionals in your lives or in your loved one who's disabled lives. So you want to be sure that you've got good communication with all of them because medical care is a team effort. It's not just you going into your doctor and your doctor telling you what to do. Nowadays, medicine is a lot more personalized. And if you go in informed, if you've read a little bit on the internet, you can bring up, oh, hey, doctor, I saw this article on the internet and I'm wondering what you think about it. And that way, it's a dialogue, it's a give and take. So you reveal what you know, and the doctor will reveal what he knows. And somewhere in the middle is the compromise that is your healthcare plan. You have to participate in that, and your doctor has to participate in that. And it's important that you have good, healthy communication about it. You know, don't get mad at your doctor because he's suggesting something that maybe you don't want to do. It might be something life-saving. So you've got to consider, okay, I've got biases against certain treatments, and your doctor may have biases against certain treatments. But if there is a treatment that you really want and you've looked it up and you think this treatment would be good for you, it's good to go in and just talk to your doctor in a friendly way and say, I've read about this treatment for this condition that I have, and I feel it would really benefit me. And of course, you've got to consider cost in that equation. How are you going to pay for it? And if Medicaid or Medicare won't pay for it, then maybe if you're at my income level, you're out of luck. But sometimes there are clinical trials of something. If there's a treatment you really, really want and there's a clinical trial, you've got a 50-50 chance of getting that treatment. So it might be worth it to sign up for a trial and see if you could get it that way. But always check with your doctor and see what he or she thinks about that treatment, because what you think is best for you and what they think is best for you might be miles apart. For one thing, there's a lot of misinformation on the internet, so you have to be really careful about your sources. And your doctor might know for sure that this treatment that you want is not the best thing for your condition at the stage that it's in. So it's really good to just, you know, communicate with your doctor and let him know how you feel and just try to compromise. Don't go in with your mind just set that I've absolutely positively got to get this, because sometimes what you think it might not be the best for you, because that doctor has got 8 years of experience, you know, 8 years of college. He's got a 4-year degree, and then 4 more years beyond that where he gets this intense study, and then he's got internships where he was following another doctor around and getting all that experience. So we don't have that, but we can definitely form opinions on what we want to do and what we don't want to do. And we just need to go into our doctor's appointments with an open mind and being ready to be honest about how bad we're feeling. You know, you get to putting on this happy face and saying, "Oh, everything's fine. It's all right." It's not all right. I'm in constant pain. You need to let your doctor know how bad it is, and he or she might be able to do something about it. So, and especially if you've got a person with dementia, then you need to keep in contact with their doctors and see what's going on with them. So that's really important. So I'm going to leave you with this thought, and hope that the information that I've given you has helped you if you've got somebody in your life with dementia, or if you've got dementia and you're worried. Then I hope some of these links will help. So y'all have a good night and take care. This is Granny Handicap signing off for the night. I will be back Monday. Y'all have a good Sunday, and don't let the disabilities get you down. I'm going to put up my goodbye scene and sign off. Good night.